the Health Minister, Dr. Joe Phaahla, providing an update on government's response to the deadly KwaZulu-Natal floods, as well as interventions in the Eastern Cape that took place in Pretoria a short while ago. My colleague, senior reporter Aviwe Mtila, was there, joining us now there for the latest. Aviwe, we had a very comprehensive overview from the Minister of Health of the different sectors, social development sector, the education sector and the health sector, about what interventions are being put in place and the state of play in KwaZulu-Natal. What stood out for you?
Well, quite pointedly, there is still a dire need for relief in the province of KwaZulu-Natal, Eastern Cape, as well as the Western Cape fire victims that have been mentioned. In KwaZulu-Natal alone, we are talking about 98 shelters that are housing around 8,700 people, individuals. We do understand the majority there being women. I actually want to touch on some of these with the chair of the social cluster, that's Dr. Joe Phaahla. Mdomkhulu, thank you for joining us at eNCA once more. You mentioned these 98 shelters, Mdomkhulu. I'm thinking, is there a longer-term plan? Is it even sustainable to house people in these shelters for extended periods?
Definitely not. It's not desirable for people to be in shelters. It's very, unhygienic, just for too many people staying and sleeping in one particular area. So it's really just to provide temporary shelter. So in the long term, the various partners, the municipality, the province, and also from our side, the Department of Human Settlement, we are working on, firstly, immediately just decongesting where there are too many people, looking at other alternative accommodation where people can be taken into. As I mentioned in the area on, especially if children, make sure that they are also closer to the schools. So that's one immediate. And as the situation settles, I know that the human settlements has been working around the clock to quantify, and quite early they already had the numbers of how many shelters have been completely destroyed, how many of those need total replacement. So their teams are already on the ground. As soon as the ground is settled such that they can be able to put those temporary, family shelter, family units, obviously not immediately brick and mortar, just some temporary units, so people will be moved into those temporary shelters as families.
I understand, Dr. Phaahla, that water and sanitation may not be under your cluster, but it severely impacts it as well. We do understand some of those 66 affected hospitals do need water, and we understand one is closed. Is there an indication how much it will take to repair water and sanitation, and how soon can the people of KwaZulu-Natal have water?
It will differ from area to area because in some of the areas, it's the actual big bulk, pipes which have been washed away. In some areas, it's arterial supplies at the end of the big bulk where, you could see, for instance, in one of the areas, I can't remember, there's Ward 53 where we went, you can see the pipes, and now those are the distribution pipes. Those will be, if the main supply line is still functional, it's easier to replace the arterial supply of the small pipes. But in an area like which supplies Umlazi, including the Prince Mshini, our understanding was that it is the actual bulk pipeline which goes either into just that section of the Umlazi and industrial area there, or whether I don't think it's necessarily the entire township, but a very big bulk. In that case, one expects that it will take much longer. So the dependence on ferried water in tankers is likely to take much longer. And the question might be, in cases like those, there might even be a need, like we did in the hospital, to just put temporary big tanks, storage tanks, which can then be filled with a preliminary kind of systems to fill in those, so that households can actually can be connected with some of the pipelines that side, the actual restoration, I'm not an expert in the area. I've not got the details from my colleague, Minister Kunu, but we are quite aware of the fact that that's going to be the biggest. You know, water and sewage system, I mean, it's far more, extensive than, for instance, electricity. If there's a storm and pylons of electricity are blown up, you take a shorter time to put new pylons, pull the wires and supply. But water and sanitation, because you have to actually connect underneath. We do understand that when one just crossing fingers that they probably, with the modern technology, there might be even, a kind of short-term technology which can be used to restore some of those supplies. But the cost, I don't have the numbers at this stage.
Okay, thank you very much. Health Minister Dr. Joe Phaahla speaking on the devastated infrastructure of water and sanitation, which we do understand 80% of the pipelines have been damaged in KwaZulu-Natal. I want to bring in another individual from basic education, the head of communications there, Aviwe Mtila. Thank you for joining us. And I do understand you mentioned some interventions where, for example, 41 schools are expected to be fixed by the schools themselves, 263 by the district departments, and over 300 implementing agencies. Those are the severely affected schools. And you mentioned that the attendance rate at this stage is above 90%. I want to get more specifics on how many children aren't going to school at the moment. Do you have the number?
Well, at the moment, our districts are reporting that most of the children are going to school. In terms of the number, we check every day the numbers only to find that the learners who are not in their schools, we have asked them to go to other schools, which means all learners are going to school, but not necessarily their own school. We asked them already last week to say, in fact, when schools reopened after the Easter holidays, we said, if your school is destroyed or if your school is not accessible, go to the nearest one. That's why last week we also issued a statement to say to school principals, please receive learners, even those that are not necessarily enrolled at your school or even those that are not wearing school uniform, because we're doing that to create an environment where learners can easily access a school. So they are in community halls, in those areas where they are in, the schools are not affected, but where they can access schools, they are going. Those that have lost their homes, they are also able to go to a school which is nearest to them. So from our point of view, all children are in schools. Yes, they cannot be accounted for in terms of them going to their own schools, but they are going to a school which is closest to them.
And how soon are you to accessing the 52 schools that are inaccessible at the moment? And are the fears around the schooling curriculum being disrupted?
Well, the disruption has already taken place. The question is how far and how bad is it? We don't believe it's bad. It's a few days, but the majority are in schools. They are learning already. It's just that there are disruptions, as we're indicating. But we should resolve that very soon, because we're already deploying 78 mobile classrooms in about 21 schools. And that we are doing to create space in those places where the classrooms have been completely destroyed or are not usable. So we are creating an environment where teaching and learning can take place even under extraordinary circumstances.
Okay, thank you very much. The head of communications of the Department of Basic Education there, touching on the severely affected schools in KwaZulu-Natal. We do understand those that have been impacted were around 630, but it's 52 at the moment that are inaccessible. And we heard that above 90% of the children in schooling, in fact, is taking place in KwaZulu-Natal.
Thank you very much, Aviwe Mtila, with that latest comprehensive update. Speaking there to Aviwe Mtila of the Department of Basic Education, and a little bit earlier with the Health Minister, Dr. Joe Phaahla, who led that latest government briefing from those sectors of health, education and social development about the interventions and the latest from KwaZulu-Natal. Let's go live.